Welcome back to the Arise interview. The Economic Community of West African States, ECOWAS, through the West African Health Organization, has donated essential medical equipment to the government of Nigeria as part of the regional response strategy to curtailing the spread of the deadly coronavirus. Now, seeing that the cases of COVID-19 in the region had risen to 90,000, the mobilization of finances and technical assistance is of great benefit to the ECOWAS region. The Director General of WAHO, Professor Stanley Okolo, said that the donation of critical medical equipment was part of the larger efforts at flattening the COVID-19 curve. He stressed that as the collaboration of partners from a common goal or for a common goal was yielding desired fruits, it has become imperative for the population to get into the habit of behavioral change adjustments. Well, I'm delighted to say that Professor Stanley Okolo, the Director General of West Africa Health Organization, joins me now. Good to have you. Thank you so much for joining us on the Arise interview.
Thank you very much for inviting me, Ngozi.
Yes,
I'm delighted to be here.
Yes, let's start from that thorny issue of behavioral change, which seems to be a major challenge. But based on the intro there, it seems some level of success is being achieved. But talk to us about the significance of this regional response strategy of yours in the fight against coronavirus within this West Africa's sub-region.
I think the thing that people often remember and they often refer to is the Ebola that we had in 2015-16. The difference, however, is that in the Ebola it was only 3 countries and we all went together to try and support the 3 countries. Borders were not necessarily closed across the region, but during the coronavirus epidemic, which the pandemic that we have now, it's all countries. Borders are closed. And so how do you ensure that you have the strong network which we had in our disease surveillance and response and preparedness architecture before the COVID pandemic hit? How do you ensure now that you implement those things that you had agreed? And that is where you find that the regional collaboration and coordination is really important. WAHO has its headquarters, as you may know, in Burkina Faso, but we also have an ECOWAS Regional Center for Surveillance and Disease Control in Abuja here. And I am situated now in Abuja over the past month or two, just to try and coordinate the regional efforts, particularly with our support to countries regarding the critical medical materials which you've talked about.
Yes.
But that's not the only thing. Let's remember that there are weak countries and there are strong countries. There are countries that have greater challenges in terms of infrastructure, in terms of human resources for health. How do we develop an advisory? How do we develop virtual online training? How do we develop targeted funding for some of these countries? These are some of the things.
Help us understand that. I mean, how do you, based on the peculiarities of each member state in the ECOWAS region, you would I can imagine how challenging it would be to come up with a uniform kind of solution that would meet each member state's peculiar problems.
That is the beauty of it. The beauty of it is that we have agreed a regional approach. We have a regional approach. But in that regional approach, we have different speeds, if you like.
Okay.
And some of the things that is the beauty of the coordination that WAHO does is that WAHO is not only collaborating and coordinating between countries, between member states of ECOWAS, but also between partners and member states of ECOWAS. We speak all the time to Africa CDC, we speak all the time to WHO Afro, and we know what is happening across, and we can bring some of that knowledge sometimes to bear. So in terms of what you asked the question, some of our countries are finding that they are using what we call a massive testing strategy within this. Some of our countries are only testing targeted cases in terms of suspected and contact, and some of our countries are actually testing people who have either comorbidities or vulnerable in order to protect them. Now, that's fine. That's what they are doing, but what we are doing ourselves is to try and say, if you do this, these are the likely good things that will come out of this. If you do this, these are the other things that will come out of it. But by the way, you require more of this, we will come and support you with it. Country A has more of this. At the moment, we will borrow from them, send it to you, and then we'll take from our regional stock and we'll put it to them.
For a country like Nigeria, what kind of solutions are you bringing to the table for Nigeria. And I would also like to know what's the level of cooperation on the part of the federal government to ensure that you actually get this job done.
Nigeria is really doing well in terms of, you may not look like it when you see that cases are rising, but it's not only in Nigeria, cases are rising in a lot of, but Nigeria is doing well if you think about where we were when this pandemic started, to now when we have 38, if I remember, 37 or 38 laboratories spread across the nation testing, and that is very important. Now, also what we're doing in terms of Nigeria is we're supporting Nigeria from most of those things that I've said. The goods that we presented to Nigeria, the only reason why we presented the goods on Saturday was because the head of state, His Excellency President Muhammadu Buhari, was elected as the champion of COVID-19 by his peers, all the 15 ECOWAS heads of state. But do you know what he did? He immediately took on WAHO and the ECOWAS support and the regional fight almost as a national thing. And so he provided us with planes, he's provided us with the warehouse where we're storing these goods, he's provided us with the logistics for us to run a regional distribution hub in Abuja, from where we are now going to distribute goods to other countries. One of our neighboring countries is coming to pick up their goods from us on Friday, and then by this weekend and next week we are going with the plane that was donated by Nigeria to the other countries to go and give that. So it's really a very close collaboration we're having with Nigeria government. We're very grateful for that. And
in providing this equipment, I see that it is in collaboration with Credit Anstalt für Wiederaufbau. It's a German collaboration that you have there, and you delivered some 12,800 goggles, 294,000 small, medium and large gloves and all of that. This seems to be in terms of materials. You know, in Nigeria, for example, the health sector has been you know, crying out in terms of the health workers themselves that they don't have enough equipment, they don't have personal protective equipment and all of that. But all of this comes with a huge financial burden. How do you finance, you know, this programs, considering the fact that Donald Trump, for example, has, you know, withdrawn funding for WHO to the tune of about $500 million? How is that affecting this?
It is challenging, and I will say to you first and foremost, you know, when Donald Trump, President Donald Trump of the U.S. Talked about, we put out a press release and we really pleaded with him not to do it, but eventually I understand that they have done it because it will impact on poor countries. It will impact more on poor countries. We will come to talk about essential health services, which are non-pandemic, because everybody is concentrating at the moment, and rightly so, on COVID-19 pandemic. But do remember that women are still dying in childbirth and children under 5, and some of these efforts at HIV, TB and all that are things that WHO is very good at doing, and we should have kept their funding. But let me come back to what you asked me about the COVID-19 question. We were the first region in Africa, once the World Health Organization declared the COVID-19 as a public health emergency of international concern, which they did on the 30th of January. We were the first region to call a meeting of all our 15 ministers of health in Bamako, Mali, on the 14th of February. And there we agreed not only to have a regional approach like I've talked to you about, how to strengthen surveillance, how to strengthen case management, we also agreed to have a costed regional plan. And WAHO then went to work immediately, costed this at about $51 million that we will use to support the countries. And within a short period of time, ECOWAS put in some money into it, WAHO put in its own money. So between ECOWAS and WAHO, we were able to raise nearly $9 million. Now, the people you mentioned is, by the way, to be really, really honest with you, we are extremely grateful to the German government, not only because of what they did with this, but because they've been with us in some of the other areas that we've been working with. Just like other partners, like World Bank, USAID, Agence Française de Développement, and African Development Bank. These are all with us, supporting WAHO. The goods that we donated is the first batch, and it's about $8 million. And there were 3 groups that funded it. So the German government, through its overseas work, which is BMZ, that is what it's called. Then also the German Development Bank, which is called KfW. These are 2 major areas from Germany that helped us. But the procurement
Yeah.
that in terms of getting the GIZ, which you talked about, which is the Overseas Development Agency and Assistance, helped us. GIZ, of course, as you know, has an office in Abuja here.
Okay.
But in addition, we also procure some of these goods through the United Nations Development Program. One of the things that I set up and I'm very proud of regarding WAHO is that we will procure through multinational ways of procurement so that we get high quality at competitive prices and easily quality assured that will come to our countries.
Now, speaking of that, I actually reeled out some of the items that you donated because I was going to ask the question, beyond donating this materials, health materials, there's a race for vaccines. Is WAHO involved in any kind of research at the sub-regional level to ensure that it doesn't over-rely on vaccines from Europe, from the United States, or even from China when the vaccines eventually come?
Unfortunately, as I'm sure you do know, well, it can be unfortunate or it might not be how you look at it. WAHO is not a research institution, and WAHO is not an institution that is involved in research directly. WAHO supports research, and there are various ways in which we do that. One of them is in terms of ensuring that some of the traditional medicines, for example, that people have that could boost immunity, WAHO is supporting them. But one of the key things we're doing regarding vaccines and all the medications is that WAHO has encouraged and supported all our 15 member states to participate in one form or the other in the solidarity trials, which is the ones that are rolled out by WHO. But let me say to you that the vaccine is really an issue for us. And the reason I say that is that at the moment, we don't really have in our region, and in Africa, maybe one country so far, candidate vaccines for COVID-19. Even though we have in our region some companies that are producing vaccines for yellow fever and the rest, and we are supporting them. We are supporting, you may have heard of the Institute Pasteur in Dakar, where they are not involved in COVID-19 vaccines at the moment, but they are involved in vaccines. And it's a very, very fantastic manufacturing outfit. They are also looking at how they will help with rapid blood tests, what we call rapid diagnostic tests for COVID-19. And WAHO is giving them as much moral encouragement, but also to some degree we are also trying to invest as foundation investors so that when those things are available, our 15 member countries will have easy primary access.
Let's talk about this behavioral change, which seems to be a major challenge. I recall the PTF boss, the boss Mustafa, actually did raise a lot of concerns that, look, this thing cannot be put only on the shoulders of the federal government or even the state governments. The people themselves need to own this. How is WAHO helping governments to send the message across to the ordinary man on the street that this is very serious business? It is not elitist. It is an equal opportunity disease.
You're absolutely right, and Honorable Boss Mustafa, the Secretary to the Government of the Federation, who is also the Chair of the Presidential Task Force here in Nigeria, is absolutely correct, and it's the same thing that happens across. What we are saying is, let us understand, there is no cure as far as we know at the moment. The vaccine is yet to come, but this is a respiratory illness. We have the power ourselves to control it, but we understand, even at WAHO, that there has been some, if you like, dislocation and distrust in terms of the public, which is why when we convened the ministers together, one of the decisions that we took out of the Ministerial Coordinating Committee meeting, which happened on the 2nd of June, was that we should try and engage more of the community leaders and the religious leaders and the young people who are influencers in order to make sure whether we can shift the mind of the public to understand this. It's not through criminalization or anything, but it's really through people understanding that this is important. And we ourselves at WAHO have also engaged various platforms, including jingles, including video advisories, in order to try and push this. Now, what we're doing with the video advisories is sending it to countries once we have been able to translate them into French and Portuguese. As you know, we do have 3 languages in
the world. Yeah, absolutely. We'll take a short break. You're watching Arise Interview. Plenty more still ahead. Stay with us. Welcome back to the Arise interview. I still have with me Professor Stanley Okolo, the Director General of West Africa Health Organization, also known as WAHO. Thank you so much for staying with us and for the insights that you've been giving us so far. Now, let's talk about, as we went on that break, I did mention that, the fact that you're wearing a mask sends a strong message that this is a very, very serious situation that we have on our hands. Let's take it down south to South Africa, where the President Cyril Ramaphosa has said he's calling for compulsory use of masks. How important is it for that to be the case? I mean, would you advise countries to ensure that, yes, this mask issue really should be taken more seriously than it is so far?
Yes, I would. And I tell you, my organization, which is the West Africa Health Organization, was 33 years old on Thursday, the 9th of July, which the 1987 was when the heads of government and heads of state created WAHO as a health institution of ECOWAS. And usually on a WAHO day, we send a message to the West Africa population. And in that message, I said that let every citizen of West Africa make a pact with friends or family, 10 of friends or family, to always practice scrupulous respiratory hygiene, to always ensure that they self-distance, and to never be seen outside without a mask. Because if they do that, 10 people with 10, 10 people with 10, the multiplier effect, the domino effect, you will see how powerfully we can bring this down. Now, that is really important, because the issue of masks is that masks stop you 80 to 90% of the time releasing the viruses, because there are so many people who carry this virus without knowing about it. And then they're walking around. And so having masks is really very important. And let's also remember something else.
Yes.
You cannot have total individual freedom in a society. They are incompatible. Society on one hand and total individual freedom. You have to curtail your freedom at some point to belong to the community. Yeah,
it's interesting you actually say that. Research recently actually shows that the issue of rule of law and the limiting of people's individual freedoms seems to have gone up in the course of this COVID-19. And that doesn't seem to be a very good thing, because these dictatorial governments could actually turn it to become the norm.
And that is why in risk communication, to try and communicate risk to people, one of the things we say it's really, really critical is transparency, honesty, going quick, and ensure that you actually humbly say what the issues are. But of course, even in so doing, because we are honest and humble enough to say, to date, we're still learning about this virus. Yes. There are so many things we're continuing to learn about it. So for example, the emerging science to show that it's not only that it drops on particles on surfaces, but that it might be airborne. That's an emerging science, emerging scientific evidence. Okay, we didn't know that about 3 months ago. So we have to share this with the public. And because we have to share this with the public, do also remember that we then have an obligation to try and say, how do we protect each other? The anxiety that is there regarding draconian laws is absolutely there. And as a public health physician, I will not support that. Okay? And that's why I'm sure you've heard some public health leaders saying, not in my name. Please don't pass this law. I'm not supporting it. And that. But what we're saying is that there has to be some give and take. So for example, I don't see any reason why we should not insist that people wear masks. And if they refuse to wear masks, we can either say we're not going to serve you if you go into a public space, or if you then insist in being in a public space where you're not going to be served, we can fine you. There are so many.
Should it be criminalized? Not wearing the mask?
The whole issue of criminalization is a different ballgame. And I really don't think that it has got to that stage that we should be criminalizing. And I think I said that before. But I think that we have to have legislation that empowers even the people that are running their shops. When you walk into the shop or into the takeaway or into the restaurant without a mask on, you're actually endangering the lives of those people. But it's not only them, their family at home. How do you know who they have a family? Who is the weakest link in every family?
And of course, we cannot talk about the mask without talking about President Donald Trump's attitude towards the mask. As of today, in the U.S., 1 out of 100 Americans actually has the infection, which is very, very troubling. Well, finally, Trump has been seen wearing the mask. So is this going to help turn a new page as far as the issue of masking is concerned?
I have a job to do.
Yeah.
My responsibility is to the heads of states of ECOWAS region, 15 countries.
All right.
I would rather leave America and
all right, you will not go into that headache. All right,
we have enough problems.
And speaking of which, Amnesty International actually says that governments in Africa must be held responsible for the death of health workers. So many health workers have unfortunately lost their lives, including in Nigeria. And that's why health workers have been calling on government to do what they need to do in terms of providing them adequate personal protective equipment and every other thing that they would require to as they put their lives on the line, in the line of danger. Do you agree with Amnesty International on this score that governments should be held responsible for the deaths of health workers?
There are two things that I will say to you that are really critical and that I know from some of the things that I see that governments are really determined to do. One is to continue to support the vulnerable in terms of the less well-off during this pandemic, because they are really suffering. And that's why you see some of the improvement programs and some of the humanitarian things that are happening. The second is that the people in the front line, they are critical.
Yeah.
We can go out as WAHO and buy a lot of connectors, a lot of other things, but what we decided to do was to go out and buy personal protective equipment to support the countries in order to support the health workers. We laid out to date, we have trained about 2,000 to 2,500 professionals on various aspects virtually. And one of the very, very critical ones we do is the infection prevention and control, which we run in terms of, it's not just providing these things. Yeah. Let us be aware also that some of the times that people get infected, even when they have PPE, is because they have not had training on how to don it and how to remove it without infecting themselves. And then the final thing is to say that it is really a problem. What we do in our region is we look at the range and get the understanding of the population, and some countries have up to 10% of the infected population being healthcare workers, and that is really something tragic. So we continue to insist on those things, but also incentivizing them. It's really important to incentivize the health workers. I say this in my WAHO Day speech, actually, because I challenge governments to continue to do these things.
All right, very, very important point that you make there. I have just a couple of minutes, so let me throw this in back to that issue of vaccines. There has been this controversy surrounding the idea of using African countries as guinea pigs in the use of these vaccines, and there are concerns about the safety of these vaccines. And people are saying, we don't have the kind of numbers that you find in Europe, in the US, so why make Africa the first port of call for these vaccines?
So let me first of all debunk that. And when I want to debunk that, I want to first of all say it is tragic that we can have the viral video of two French people talking about, oh, let's go and test these things in Africa. And that is really, it is such a disservice to what is the normal global mainstream science, which is what's happening. To date, there are about 150 candidate vaccines. To date, only about 2 of these vaccines have reached the stage, because in scientific trials we go from phase 1, phase 2 to phase 3, have reached phase 3, which is where we start trying them out in people.
Remdesivir and dexamethasone, other ones?
No, those ones are treatment drugs. Let's even talk about the vaccines. We're talking about the vaccines. Yes. There are 150 candidate vaccines. And the Oxford vaccine is the one that is, we know, and was about the first to go into phase 3 trials. And there are 50 countries participating. Do you know how many in Africa? 3. 3. Only 3. And so it's South Africa who have started, Kenya and Egypt, to my understanding. So really, really, it is a complete fallacy. But it is not helped when you hear some really, well, I won't call them scientists.
Well, I'm glad you have. I'm glad you've debunked that. Thank you so much, Stanley Okolo, DG WAHO, that's West Africa Health Organization. It's been a delight having you on the show.
Ngozi, please continue to do the work of trying to educate the public.
Yeah.
You must shoot those false social media narratives.
Absolutely.
This is real.
All right, thank you very much. It is
Thank you
real.
very much.
That's it from us. I am Ngozi Alebu.